The following program contains mature subject matter. Viewer discretion is advised.
From Hollywood to Washington, D.C., you've seen the high-profile allegations of sexual assault. The truth is, every 98 seconds, someone is sexually assaulted here in the U.S. With advances in DNA testing, you'd think these crimes would be easier to solve than ever before. Sadly, that's not always the case. In fact, most rape kits have not been tested because of a backlog, or worse, many are thrown away. Why? That's what we're going to be talking about right now, because 33 states are currently in audit trying to figure out what's going on with the backlog, trying to figure out what's going on with rape kits being thrown out, in many cases prematurely. It's a huge problem.
It is. Dr. Nita, I mean, you're the expert on the panel on rape kits. What exactly do they entail?
So once someone comes to the emergency room or they go to a healthcare provider, we take a lot of swabs, we collect your clothing, we also get hair from the pubic region, we get hair from your head, just anything that could allow us to get DNA evidence to prosecute. Now, what I want people to realize is if you find yourself in this situation, if you are a victim of sexual assault, know that you do not have to report the crime before you get the exam done. So we can do the exam and then we can store that evidence for you, so if you decide to report it in the future, we have the DNA on file. And also, if someone is a victim of assault, then a lot of times they will feel inclined to shower or change their clothes. And I understand why they would want to do that, but please, please, please don't. If you can help it, like, don't shower or bathe. Try not to use the bathroom, brush your teeth, brush your hair, eat or drink, change your clothes, or if you do change your clothes, put them in a bag, because we can really get some valuable information. Now, if you happen to do those things, you can still get an exam, but it's very beneficial because we really want to put these people away. We need to prosecute.
And you raise a really good point here, which is so many of these cases are dependent upon having some resources to potentially prove guilt in a court of law. It is evidence, and a lot of doctors have never done a rape kit.
Right.
A lot of examiners have never done a rape kit. It's very different than a professional who...
Sure, it needs to be done the right way.
It does need to be done the right way, and there are communities who have put forth an effort and who have funded these programs so that examiners are available. And it's not just to one emergency department. They may be available to an entire area.
I mean, that's a huge issue, but the other two flaws is that, number one, the kits are sitting there, not being processed, or there's no consistency in how long these things should be kept. They're being thrown away too quickly.
We were talking about in some places within 30 days thrown out.
Right, and as far as no consistency between states, you're absolutely right. So for example, in New York, and this is just New York, it doesn't apply to other states, there's no statute of limitations when it comes to how long a person will have until they can report it. But a rape kit will be thrown away after 30 days unless a person signs something and says, please don't throw my rape kit away after 30 days, or the person says, send my rape kit to the police department, because the police department is obligated to send it to a forensic lab within 10 days. So that's like, there's not a lot of consistency there, and you're dealing with so much after this incident. You're not thinking,
I think that's probably what's happening.
And you're not saying how long, and nobody's thinking, oh, they're gonna throw it away in 30 days. You're thinking, I have time to think about this, to heal, to process this, and I can come back in a few months. Your rape kit might be gone.
Right, so you have to be
informed about that. Those are great tips for women to protect their rights.
And the two issues here are backlog and kits being thrown away. Obviously, a backlog is preferable to a kit being thrown away.
Like in a murder case, would they throw the evidence away?
Right, and that changes this entire
evidence away after a month?
Yeah, and that changes the entire case from one with medical evidence to one that's a he said, she said scenario, which is much more difficult to prove causation.
And the whole issue of consent, if there's no evidence at all, I mean, was there trauma, et cetera, a physical exam, then
and just being informed that
hard to prove.
Yeah, and just being informed that there is a certification process, so even asking for the evidence to be collected in the right way by a certified examiner, that's a really important takeaway, I think, as well, and that they can also receive treatment as a part of presenting for an exam like you just mentioned.
And also the chain of custody, that's a big part of it. I can remember, like, I've done a lot of rape exams, and unfortunately, and I can remember sitting sitting outside of the room, like with the kid, like when is the person coming to open the door? Because there's no way I'm just gonna leave it with somebody else. No. That breaks the chain of custody. And then if this person does want to report it, they can't go, you know, to court.